Okay, so we were discussing bacterial respiratory tract infections, and the recording cut off. We had some technical problems. I apologize for that. I am a Dr. Teke Apalata, a clinical microbiologist. So we were discussing bacterial respiratory tract infection, and actually we were dealing with specimen collections and the specimen that we can collect from patients who are on a ventilator or who are mechanically ventilated. And we mainly discuss endotracheal tube aspirate or ETA. So we say that this is the respiratory tract, and you have the trachea, and you have an endotracheal tube that is inserted. Then from there, the microorganism can form what we call a biofilm, and one pathogen can progress to the lungs and cause a pneumonia. So from here, among these patients, you can then aspirate some of the secretions that are here within the tube, the endotracheal tube, or through the endotracheal tube, and send it to the lab for examination. So that's what we call endotracheal tube aspirate. So the same microorganisms that you can find in the biofilm are the ones that are responsible for causing the infection. So we have the pathogens that are able to cause hospital-acquired pneumonia. We have spoken about the bacteria, atypical infections, and we say that those mainly cause, in summary, those bacteria like Streptococcus pneumonia, Haemophilus influenza, Moraxella catarrhalis, Staphylococcus aureus, and other gram-negative, they are able mainly to cause a community-acquired pneumonia. And we say that Legionella, Mycoplasma, Chlamydia, Bordetella, Coxiella, Nocardia, they are able to cause what we call atypical pneumonia. And we have then said that most of cases of hospital-acquired infections are mainly gram-negative bacteria like your Pseudomonas aeruginosa, Klebsiella pneumoniae, Acinetobacter baumannii, and the Enterococcus bacteria, the Enterobacter species, they are able to cause a hospital-acquired pneumonia. Beside the laboratory diagnosis, you also can confirm, support your diagnosis with a chest X-ray. And I was showing this chest X-ray of one of my 14-year-old woman patient who was diagnosed with pneumococcal pneumonia. And on this chest X-ray revealed a left here on the left lobe, you have a left lobe opacity with pleural effusion. So you can see here there is an opacity with pleural effusion. So this lung is actually replaced by fluid, what we call pleural effusion. We have another one here. This is a 48-year-old patient who was diagnosed with Haemophilus influenza pneumonia. And the chest X-ray shows bilateral, so both sides. You can see here and there bilateral opacities with predominantly peripheral distribution. So this is what you can see here. So I can leave these two chest X-rays for you for interpretation. We have this one, and we have also the other one. So you can tell me what you are seeing here, and you can also tell me what you are seeing here, both sides of this chest. Leave a comment below and let's discuss the diagnosis for those two chest X-ray. Okay, so thank you very much, and this completes our series of lectures on respiratory tract infection. The first part of this lecture, we have discussed viral respiratory tract infection. And in the second part of this lecture, before it cut off, we were discussing bacterial respiratory tract infection. And for the bacterial respiratory tract infection, we structured it in a way that we have first bacterial upper respiratory tract infection, then we have bacterial pneumonia. And the bacterial pneumonia, we divided that into community-acquired pneumonia, and we also had hospital-acquired pneumonia and atypical pneumonia. So we have discussed the pathogens, and we have discussed the specimen that can be collected for each of those cases. Thank you very much. Goodbye.